There are few things more precious to us than our eyesight. In fact, a recent survey revealed that the number one health concern people have is losing their vision. It's no surprise that the older we get, the more susceptible we are to vision problems, which is why regular eye exams are recommended, even if we are not experiencing difficulty seeing.
It's very important for individuals to get their eyes examined, for the most part on an annual basis, beginning around school age, not only to screen for changes in vision and eyeglass prescriptions, but also to screen for eye diseases like cataracts or glaucoma or macular degeneration, which are diseases which can rob you of your eyesight in very subtle ways at first that aren't even detectable. So it's important for us to examine the eyes to screen for these diseases in order to detect them and treat them before they become a problem.
From simple nearsightedness and farsightedness to more severe eye conditions and diseases such as cataracts, glaucoma, macular degeneration, and corneal diseases, most eye problems can be corrected if caught early.
Over the last several years, there have been some major advances in technology to allow us to better treat many eye diseases, from refractive surgery with new lasers to be more precise with the treatment, to glaucoma, where we've got new lasers to treat glaucoma, to techniques for corneal transplantation, where we can perform the procedure through a tiny incision, to new techniques for macular degeneration for us to be able to treat a wet macular degeneration, to new lasers for cataract surgery to allow us to perform the procedure faster and with much greater safety to the patient.
Keratoconus is a degeneration of the structure of the cornea, where the shape of the cornea slowly changes from the normal round shape to a cone shape. Corneal cross-linking is a new treatment being studied in clinical trials, which may strengthen the cornea and potentially help patients avoid the need for a corneal transplant for this condition.
Corneal cross-linking is an exciting new procedure which uses vitamin B2 drops, riboflavin drops, combined with a medical-grade ultraviolet light to chemically strengthen the cornea to help prevent the progression of diseases like keratoconus and post-LASIK ectasia. This procedure is only available through clinical trials here in the United States, and we're fortunate to be selected as one of the sites for the CXL USA clinical trial.
The lens of the eye is mostly made of water and protein. The protein is arranged in a precise way that keeps the lens clear and lets light pass through it. But as we age, some of the protein may clump together and start to cloud a small area of the lens. This is a cataract, and over time, it may grow larger and cloud more of the lens, making it harder to see. But today, recent advances in cataract surgery technology are getting great results correcting cataracts.
The latest innovations in cataract surgery have been to allow the patient to not wear glasses after cataract surgery. And this has been accomplished by the use of accommodative lenses and multifocal lenses and toric lenses, all of which have revolutionized cataract surgery to the point where the majority of patients will no longer need glasses after their procedure.
At the forefront of research and treatment of many eye conditions is South Shore Eye Care, located in Long Island, New York. Its staff of ophthalmic technicians and eye doctors use cutting-edge technology and diagnostic equipment to find their patients' best vision and evaluate them for any ocular diseases.
At South Shore Eye Care, we're constantly updating our equipment to have the best technology available, both for therapeutic and diagnostic needs. From a retinal disease to a glaucomatous disease to cataracts and corneal disease, for which I'm a specialist, we're basically set up here to treat any kind of ocular problem. From one room where there's a routine patient here for a regular eye exam yearly to a next room where I have a central vision-threatening corneal ulcer, we at this practice can take care of those issues.
Even the youngest of eyes can have visual difficulties. Whether it is crossed eyes, prematurity, an inherited condition, or a common infection, children's eyes are not immune to problems. With a kid-friendly atmosphere, South Shore Eye Care provides the special equipment and expertise important for pediatric patients.
The pediatric population, because of their being younger and smaller, have a number of developmental things that can occur. They can have anything from blocked tear ducts to oculomotor imbalances where the eyes cross or turn, and these issues need to be addressed. And here at South Shore Eye Care, we try to set an environment that's conducive to determining these problems and figuring a course of action to treat it.
At South Shore Eye Care, they strive to help you achieve the best vision possible. Years of treating advanced eye disease have given them the experience and skill necessary to treat your vision problems.
The practice of ophthalmology is constantly adapting and evolving to new technology. Here, the doctors at South Shore Eye Care can perform many lasers to treat various ocular conditions, most notably glaucoma, diabetic retinopathy, and peripheral retinal tears. We even have lasers that specifically treat the haze behind the lens that can develop months or years after cataract surgery. The doctors here also perform LASIK and PRK, photorefractive keratectomy, which is used to reshape the cornea to treat nearsightedness, farsightedness, and astigmatism.
Whether you need glasses, treatment for an eye disease, cataract surgery, laser vision correction, or even Botox and Juvederm, South Shore Eye Care can help. Dedicated to saving your sight, the goal at South Shore Eye Care is to provide nothing but the finest eye care in all of New York. To learn more or to make an appointment, call today or visit southshoreeyecare.net.